It will be very obvious during today's talk that there are lots of things that you will not be able to see in your skulls. For better or for worse, most of your skulls seem to be intact. And today we're talking about stuff on the inside. There is a box of bones back there that has various isolated bones, the kind of stuff you'll see in pictures today. Your atlas, should you have bought an atlas, will have pictures of isolated bones, and obviously there's thousands of places on the web that if you want to see what a sphenoid bone looks like floating in space, you can also look that up. We have one of these Baoxing skulls, the exploded skulls, where you can see isolated bones. There's one up here and there's one in the back. There is also a red toolkit full of individual bones that have been sort of separated out and taken apart from skulls that you can look at. These will be here basically most every day, all day, if you have any spare time between your busy other classes. And in addition, Doctors Fernandez and Wilberg, for some combination part thereof, will be here this coming Sunday between noon and 4 p.m. to answer questions and let you in here to look at the various skulls and parts of skulls and bits and pieces should you want to review before. Yes, Amanda? Are you going to be in this room?
Yeah.
Yes. Okay. Okay.
Will we turn off the board lights?
Yesterday's introduction seemed sort of complex, I'm sure. There were all these sutures and parts of bones and names of bones and grooves and holes and things like that. Today's will be even worse. And just to warn you, most of you have the good part is most of you have really nice skulls in those lunch bags. The bad part is really nice skulls are all together. So it's hard to see the stuff on the inside and the bits and pieces. As I said, in the back there's a toolkit that has isolated parts of skulls, individual bones that you might not be able to see in a complete skull, but you can see it in the exploded skulls. You can see it in the bits of bones, and like I say, you can see it in your atlases and other things. So if I show pictures of something and you hold up a skull and it's not there, I can't see through the bone, don't be surprised. Okay, so yesterday was external features. We talked about all these bones that you see on the outside. Today we're moving on to the inside to look at the various parts of bones of the skull. Again, internal stuff. Okay, so here's a skull sawed in half, right down the middle, which you will do actually in the course of the dissection sometime near the end. These are the things you saw on the outside, the same names, pretty much the same positions. There's the big frontal bone up here, followed by a right and left parietal behind it, a big old occipital wrapping around from the back all the way under. There in the middle of the side is the temporal bone. Here you can see a little more sphenoid coming towards the midline here. And the bone you haven't really seen much of before, the ethmoid bone, which you can see, we'll talk about in excruciating detail in a few minutes, which forms a little bit in the front of the brain case up here and has a big plate that extends down between the two halves of the nasal cavity. Here's that vomer that we talked about. We saw a little bit of it from the back and maybe a little bit of it from the front of the nose. And again, it forms a plate that separates the right and left half of the nasal cavity. Here's the maxilla, our old friend, with all the upper teeth stuck in it. Here's some more of that little palatine bone. Remember when we looked at the hard palate from below, we saw the front part was made up of the maxilla and the back was made of the palatine bone. That was the horizontal portion of the palatine. There's going to be a vertical portion we'll see in a few minutes. The nasal bones on either side at the top of the nasal opening. And there's the pterygoid plate and parts of the sphenoid poking out behind here. And the body of the sphenoid, which again, the sphenoid is a very complex bone with lots and lots and lots of named parts. Okay, so this you actually should have, even if it doesn't fit onto the skull. So most of your skulls have had the top of the brain case sawed off, and if you saw off the top of the brain case and turn it so that you're looking on the inside, again, you see the same bones that we saw from the outside. Here's the frontal, right and left parietal, and a single occipital back there. The suture between frontal and parietals is the coronal suture. And the place right here where they meet is known as bregma, although bregma is usually identified on the outside, not on the inside. And then the occipital bone, again, which joins, articulates with the parietals by this suture known as the lambdoid suture. And where the two parietals meet the occipital, it's known as the lambda. And then the sagittal suture running between right and left parietals. Same things we saw on the outside. However, there are some things on the inside that we didn't see. There's a little, in the midline of the frontal, right in the midpoint up there is a little point known as the frontal crest. And we will see there's some structures that attach there when we get to the inside of the brain, the meninges. And then there's a groove here, which is for a superior sagittal sinus, which is a venous drainage system that runs along this middle area here. And then there are these little holes on either side of this sagittal suture, which are known as the foveoli granularis. Okay, they're little bumps, and they're very interesting because you remember that cerebrospinal fluid that we saw down in the spinal cord, or didn't see in the spinal cord, but we knew was there. These are remnants of the way in which that cerebrospinal fluid comes from the subarachnoid space and goes into this venous, this big vein up here. And we'll talk about that when we talk about the meninges. It turns out that there are these little fountains of cauliflower-like things that cerebrospinal fluid squirts from inside the subarachnoid space up into this vein, and where that stuff is shooting up, it causes these depressions in the skull. But we'll talk about that later. You just need to know their name for the moment. Okay, if we look at the edge here, so here's the outside of one of these skull bones, a parietal, and this is the inside. So it's sort of like a sandwich, right? So here are these two pieces of bread, and then there's that cheesy Swiss cheese looking stuff in the middle. The part out here is called the outer table of bone, and not surprisingly, the part over here is called the inner table of bone. They are covered with a connective tissue. The connective tissue on the outside is known as the pericranium, and the stuff on the inside is known as it's part of the dura mater. It's called the periosteal layer, the periosteum, which is next to the bone. There's that dura mater that we saw inside the spinal cord, lining the spinal cord, that tough stuff on the outside. It also covers the brain, and the outer part of it is lying right up against this inner table of bone, the cranial bones. And the sort of place with all the part on the inside, all these little holes inside the center there, known as the diploe. And we'll talk about the anatomy. Just one thing you might see in your skulls or in your cadavers when we open them up, it's not uncommon to find the frontal bone is much, much, much thicker. It's been thickened along in here, which has the fancy name of hyperostosis frontalis interna, which means lots of extra bone on the inside of the frontal bone. It's apparently very common in older women who have died, and obviously many of your cadavers are older women. No one seems to know why it happens, but it's not uncommon to, when we open up the brain case of the cadavers, to see, oh my God, the front end's just got all this extra bone on the frontal up there. Don't be upset or surprised. And there's an arrow showing that it's really there. Okay. So this is the cranial. These are the cranial fossae. This is where the brain sits. And we will learn later that, in fact, the parts of the brain, the lobes of the brain, are basically named after the bones that they're sitting in. So there'll be a frontal lobe here, and an occipital lobe back there, and a temporal lobe down here, and a parietal lobe back up here. Here are the bones that you see when you open up take the top off and look down into the cranial fossa. Here's our friend, the frontal bone up front, as it's supposed to be. Little ethmoid forming at the midline with all these funny little holes around it. The parietals out here on the side, which we saw before, but below them the temporals, then the occipital in the back, and here's this petrous portion of the temporal bone, that hard portion sitting in there, and then the sphenoid, which is on the midline but extends out towards either side. These parts out here are known as the wings of the sphenoid. And we've seen these holes before from the bottom, and we'll go over them again from the top. So this is one half. Here are some names of these parts. So this area up here, the front part, not surprisingly perhaps, is called the anterior cranial fossa. And the border here is this front end of this part of the sphenoid here, and then this area up here is called the lesser wing of the sphenoid. We'll learn about that later. But there's a big ridge, and if you draw a line along that ridge, that separates the anterior cranial fossa from the middle cranial fossa. And you should be able to figure out what bones are in the anterior cranial fossa. There's a frontal bone, an ethmoid, and part of the sphenoid. The middle cranial fossa here. The posterior border is this ridge running right along the petrous portion of the temporal bone. So the middle cranial fossa's got more of the sphenoid, part of the temporal bone, and out here the sort of base of the parietals. And then this is the posterior cranial fossa, which is mostly occipital bone, but again, some more of the temporal. So the temporal band's over here, covers over here, and a little bit of parietals back in there. Okay, bone by bone. Again, here's our ethmoid up front, lying surrounded by the frontal anteriorly and laterally, and by the sphenoid behind. There's a picture of it, which looks more like what you're seeing. So this is sphenoid, frontal, and ethmoid. Okay, so let's go back to our friend the frontal. Here's that, remember there's that groove for the superior sagittal sinus up there. This little area, this whole ridge is called the frontal crest, and the depression's the groove for the superior sagittal sinus. There's a little bitty hole right where the frontal runs into the front of the ethmoid, known as the foramen cecum. And this area of the frontal that's on top of the orbit, so the orbit's beneath there, is known as the orbital plate of the frontal. Here it is from side view. Okay, so there's the orbital plate. There's an orbit down under there. There's a hole. This bone is not solid. In addition to these little diploi in there, there's a big sinus in there, just an air-filled space in the front part of the frontal bone, known as the frontal sinus. And we will later learn that the frontal sinus is one of these, they're called paranasal sinuses, and it drains into the nasal cavity. So there's the orbital plate again. And then there's a groove sliding up on the inside, and that's grooves made by something called a part of the middle meningeal artery. Okay, so or middle meningeal vessels in general. So this middle meningeal artery comes out here and cruises up there and leaves all these pretty little pictures. Okay, so this part of the ethmoid that is exposed, this is the top of the ethmoid bone that's exposed in the anterior cranial fossa there. There it is from side view. And you can see the ethmoid's got all these holes in it. Anybody know how many holes are in the ethmoid, in the cribriform plate? Take a guess. Divide by 4.
30.
You're not good with the
I don't have your iPhone, do you?
Sure.
Apparently about 32 on each side. However, if someone's looking for a project, you can count the holes in all the cribriform plates in this room, and we'll have a real quantitative number. Okay, so here's the ethmoid in another view from the midline. So there's the cribriform plate again with all its holes. And there are little there are nerves. The olfactory bulb is actually going to be sitting there and sends nerves down into the nose that enables things that you smell to get back to the brain. We'll learn about that later. There's a little ridge here. Sort of looks like the top of a shark, but to somebody it looked more like a crest of a rooster, so it's called the crista galli. Again, the cribriform plate in cross section. And then there's this big part that sits down between the right and left sides of the nasal cavity, known as the perpendicular plate of the ethmoid. Yet another view. So if you'd sawed your skull exactly in half, again, as you will eventually do, the nasal septum, the part that separates the right, everything coming in the right nostril from everything coming in the left nostril, is divided by this thing called the nasal septum. And the nasal septum is basically made up of 3 different parts. The upper part is the perpendicular plate of the ethmoid. The lower part is that vomer that we saw from the back. And then there's something known as the septal cartilage. It's not bone, but it's cartilage forming the front part here. So this nasal septum is made up of 3 parts. More ethmoid. Okay, if we look on the side, okay, so we're not seeing the midline again. Here's that crista galli again, sticking up into the front of the anterior cranial fossa. Here's the cribriform plate, lying right there. And then there are 2 of those scroll-like things. If you look through the nasal cavity, you see these sort of scroll-like things that are covered with epithelium that moisten air and also grab bits of stuff out of the air for you to smell. This is